Good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here at the Region of Peel, and Nancy McDonald-Duncan, our Acting Fire Chief and Director of Emergency Management, and today with Sam Rogers, who is our Director of Enforcement here at the City of Mississauga. I first want to take a moment to talk about the temporary layoffs here at the City. As we moved into the grey lockdown zone, the City had to close all of our community recreation centres and our cultural facilities as well, including the Small Arms Building, museums of Mississauga, the Living Arts Centre and the Meadowvale Theatre. And this means we again had to make the difficult decision of laying off temporarily about 110 part-time employees who work at these facilities. I should include the libraries as well, effective December 7th, 2020. I am so sorry for all of the affected employees. I can only imagine how tough this is going to be, especially with the holiday season around the corner, and especially what you've encountered already this year. We will continue to assess the impact that the lockdown is having on our city operations, and will continue communicating with those who have been impacted. We have made our employees and family assistance program available to all our staff during this difficult time. And I'm also encouraged that many of our employees will be eligible for the Canada Recovery Benefit during this temporary layoff. The reality is that the City is facing significant financial pressures as a result of the second lockdown, and in order to be fiscally responsible, we had to make some tough decisions. Mississauga has now been in the province's grey lockdown zone for approximately 10 days. And while we continue to see increases in our daily case numbers, we are not seeing exponential growth as we had seen earlier in November. Peel Region averaged 500 daily cases over the last 7 days, with Mississauga averaging just over 150 daily cases. And in Mississauga, we are at 118 cases per 100,000, and that's 9 more than last week. The situation at our hospitals remains extremely precarious. Trillium Health Partners has reported 2 outbreaks during the last week, one in its cardiac wing and another this past weekend at the ICU. THP is currently dealing with 66 COVID hospitalizations, 14 COVID patients in the ICU, and another 61 suspected cases. That's 140 rooms or more being used for just COVID patients. At William Osler Hospital, the same is true. 66 COVID hospitalizations, 15 patients in the ICU, and 48 suspected cases. That's almost 130 rooms being used for COVID patients. What continues to concern me most is the situation in our congregate living centres, with 19 of our long-term care homes, 7 retirement homes, and 4 group homes currently in outbreak. Mississauga's Tyndall Seniors Village continues to deal with a massive outbreak that has led to more than 90 residents and 80 staff testing positive for COVID-19. To put things more starkly, more than 50% of our long-term care homes are currently in outbreak. What's clear is that the virus is continuing to control us. We are not controlling the virus. All of us need to continue to play our part in listening to the advice of public health officials. I know just how big an ask this is of you, of everyone, particularly around the holiday season, but please stay home, work from home, as much as possible. Only go out for the essentials and limit your in-person contact to just your immediate household and essential supports. This is what it needs to take back control of the virus. To avoid school closures and more hospitalizations and further spread into our long-term care homes. It's how we avoid preventable deaths in Mississauga. It's my hope that by the end of the week, we will begin to see a positive impact of the lockdown measures, and eventually, hopefully soon, a loosening of the restrictions. The truth is that letting our guard down now could be disastrous for our community, especially as we begin to hear more and more about viable vaccines. Just today, it was announced that the UK will begin their rollout of the Pfizer vaccine starting as early as next week. Dr. Lowe has told me that his team is planning for mass immunizations in Peel Region when the vaccine becomes available here. And while we're still waiting for more information from the province's Ministry of Health on what Ontario will look like, it will undoubtedly be high-risk residents who receive the first doses of the vaccine. The big challenge for Peel will be finding the right balance in terms of how to deploy our resources to continue to controlling the spread in our community while also immunizing our population. I have confidence that both the province and Peel Public Health will be ready for this challenge whenever the vaccine becomes available. I also have confidence that our federal government will secure the necessary amount of vaccine in a timely fashion. We know that our 4 pharmaceutical companies have already submitted their vaccine for approval from Health Canada, and that our Federal Minister of Procurement is actively working to ensure that Canada and Canadians get what they need. The effort to immunize residents will take an enormous effort from all levels of government. And you have my word that I will continue to update you as more information becomes available. What is clear is that we're getting closer to finding the long-term solution to this pandemic. I also realize that COVID fatigue is setting in among many residents, especially among the younger demographics. But we can't let our guard down after the huge sacrifices that we have all made, especially with a vaccine so close. And that's why I was frankly angered by the news of the massive house party in Mississauga that took place over the weekend, and that led to 25 Part 1 charges at $880 each, and 2 Part 3 summonses for the hosts that will range from anywhere between $10,000 and $100,000 each. Not only was this highly irresponsible, but it was completely a selfish act by those who organized the event and for those who attended it. The vast majority of Mississauga residents are following the rules and doing what is needed for the collective good. But to see people flagrantly break the rules is completely unacceptable. We are still in a pandemic. People are still dying from this virus. My hope is that these changes send a strong signal to the community that we will not hesitate to enforce the rules. I was also extremely disappointed to learn that over the last weekend, multiple non-essential businesses were charged with opening their doors to in-person shopping, despite the clear directive not to. This is also totally unacceptable. We have so many businesses that are complying with the rules. It's infuriating that some seem to think that the rules don't apply to them. Since the new lockdown measures have come into effect, our enforcement team has put into place enhanced measures to ensure both residents and businesses are complying with the new rules. And now, I'd like to call up Sam Rogers, our Director of Enforcement, to talk a little bit about what this means and the kind of enforcement activity that we've been seeing over the last week. Sam, please come up.
Thank you, Mayor Crombie, and good afternoon, everyone. Since moving into grey lockdown zone, our enforcement division has seen a significant increase in both public complaints and violations. Beginning last week, we launched an ambitious proactive inspection plan designed to get ahead of violations and correct behaviours quickly. In the past 10 days, we have conducted over 5,000 proactive business inspections and violations were observed across all sectors, including gyms, retail stores, car dealerships, pet retail, salons, furniture stores, restaurants, electronics and appliance stores, just to name a few. There have also been several occurrences of private gatherings that have resulted in charges, the most notable occurrence being a large house party that resulted in 29 charges over the weekend. Since the lockdown, we have laid a total of 64 charges and issued 58 notices of contravention. The vast majority of people and businesses are complying. However, there are still too many people intentionally breaking the rules and putting others at risk. I would like the public to know that we understand your frustration and confusion as the regulations continuously change. We will continue to work with you to make sure that you understand the current measures. However, blatant violations will be strictly enforced alongside Peel Police and Peel Health. We will investigate every public complaint for private social gatherings, and we will continue to proactively inspect businesses. If you're violating the rules, we will be knocking on your door. In closing, I would like to thank our frontline enforcement officers for their steadfast efforts throughout this pandemic. They have had an extremely difficult job, and their resilience, professionalism, and dedication to the city cannot be understated. I'm proud to represent them here today. Thank you, and I'll hand it back to Mayor Crombie.
Thanks, Sam. Before I bring up Dr. Lowe, I want to talk about the motion I put forward last week that passed unanimously at Peel Region Council. The motion asks the provincial government to immediately look at ways to address the inequality between small businesses required to close for in-person shopping and those permitted to stay open. To be clear, the motion does not limit the in-person sale of non-essential items at big box stores, what I originally proposed in the motion. Council debated this motion for over 3 hours, and several concerns arose from our decision. Although the original wording of the motion was amended, I am pleased that the intent remained, supporting our small businesses. What's important to me is that we had a consensus at Council that presented a united front in defence of our small business community. And I want to thank my colleagues at Regional Council for passing this motion and making a strong statement. I put this motion forward because I've been hearing from small businesses in our community that are hurting badly, as you heard last week at my press conference. They feel like the new lockdown regulations are unfair and put them at a disadvantage compared to the big box stores. They feel like they can't compete, and many will lose everything. Frankly, many are facing bankruptcy. I hope the province and our local MPPs hear our plea and the plight of our small businesses. We have limited powers at the city, but we have a strong voice as mayors and councillors. I'm using mine to put this issue on the agenda and ask for action. We can't afford to let Main Street die while multinational corporations thrive. It's as simple as that. The province needs to find a way to level the playing field for our small businesses and to do it safely. Residents also need to step up if they can. I once again encourage everyone thinking about buying local this holiday season when they can. When doing your holiday shopping, please think about our local retailers. Buy your gift cards and shop online from amongst our local retailers. This is the time of year when many of our small businesses are used to making as much as 50 or 60% of their revenue, and they're being forced to close for in-person shopping, and it's taking a serious toll on their bottom lines and their lives. They need your help now more than ever. So please order online for curbside pickup, for delivery from one of our thousands of fantastic small retailers. I ordered some gift cards myself this weekend for my family and friends from some of my favorite local shops. Please do the same if you can. And if you can, please make it a priority to order takeout at least once a week from one of our fabulous restaurants. These small acts can go a long way in helping save jobs and help our businesses survive. Lastly, I want to make it very clear that the province and the federal government need to find a way to immediately assure every worker in this province that they will not lose their job or their paycheck if they test positive for COVID-19. This was the sentiment echoed by my colleagues on my weekly call with the GTHA mayors this week, as well as on my call with the Ontario big city mayors. We simply cannot have people afraid to get tested and go to work sick because they don't have a financial backstop. As of today, we have had no response from either level of government, but I'm urging them to take action now. We've seen some promising news this week as we move closer to a viable vaccine, and I'm truly hopeful that our numbers will begin to go down and that we begin to see loosening of the restrictions. So I'm asking everyone to please hang in there, please remain vigilant, and please follow the advice of public health. Stay home as much as possible right now. Only leave home for essential reasons, whether that's going to work, going to school, buying groceries, or going outside to have a walk or exercise. And please limit your in-person contact to your immediate household. I know you can do this, Mississauga. We're almost there. And now, I'd like to invite Dr. Lawrence Lowe up to the podium to give us his weekly update. Dr. Lowe, over to you.
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 8,931 cases of COVID-19 in the City of Mississauga. 863 are active, 7,795 have resolved, and 273 have passed away. It's understandable that many of us are tired of COVID-19. We've all been impacted in different ways. I particularly empathize with our business owners who are again sacrificing to stop widespread community transmission. You have my support for any and all assistance that you might receive during these difficult times to make things more bearable. I am concerned, however, that we are to some degree forgetting the human element behind some of the other numbers that I report. I keep hearing some people weighing the economic impact against the number of cases and hospitalizations reported, and morbidly, even sometimes against the lives lost to date. This is dangerous because we know that we avoided the worst case projections in Peel and Canada through effective measures that were designed to limit transmission. Together we stayed apart and beat the first wave, and as summer gave way to fall, our contact tracers at Peel Public Health held off the second wave through September and early October until the post-Thanksgiving surge pushed us over the brink. We did this with nearly 200 additional staff hired on top of all of our redeployed personnel to support case and contact management, along with nearly 100 nurses that supported school reopening and continue to support monitoring of outbreaks in that setting, along with additional support from our partners at the province and at other health units across Ontario. But capacity is always finite. At some point, all fire departments run out of trucks if fires keep getting set, and a lot of that depends on what is happening in the community. Now in Peel, we've seen much transmission from essential contact, individuals that cannot reduce their in-person contact outside their homes due to their situations. But we're also increasingly seeing transmission from fatigue and colder weather leading to household mixing, especially indoors, close contact with people outside of one's immediate household. In those instances, it's often discretionary contact that is occurring. And so often it's framed as, it's just one get-together. But multiplied over tens of thousands of times, just one very quickly becomes the one get-together that is keeping this virus moving in our community. That's why these gray lockdown measures are in place. They're intended to reduce venues for in-person interactions to get things under control right now. Importantly, that's also needed because the COVID-19 numbers that I report every week aren't faceless. They are people in hospital. They are fellow residents dying. They could be our family. They could be our friends if the tables were turned. They're often our most vulnerable, our elderly, those with medical conditions. They're our frontline healthcare providers who have already sacrificed so much to care for others. They are our essential workers, often our newest Canadians, are racialized, are precariously employed. These are the ones that are bearing the brunt of the pandemic, and no surprise, we're not hearing that much from them. So while we focus and talk about the economic impacts of the pandemic, we can't forget the very real toll that COVID-19 is having on the health of our community. These measures are in place to keep all of us safe, especially supporting those who are most vulnerable. Now, to truly get ahead of COVID, we do need to do more to protect our essential workers with income supports, workplace protections, and paid sick leaves. And we need to continue to work, as Peel Public Health is, with our community partners to extend outreach and communications, and with our provincial partners at Ontario Health in reducing barriers to testing and preparing for mass vaccination. But as these all come into play, we have to remember that this pause is not about being punitive and hurting people. On the other side of it, we are trying to protect others. So please, as you are able, do your part. Ignoring advice and regulations doesn't make you a freedom fighter. To me, it shows a certain callousness and disregard for fellow human beings that are impacted by this virus, often our community's most vulnerable. So remember, don't hold or attend social gatherings. Limit close contact to those you live with and 1 or 2 essential supports. Reduce your in-person meetings beyond your home to only the most essential reasons. And when you do meet, distancing, masking, and don't go if you're sick. That's how we save lives and stop spread. It's that simple. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And now, Dr. Lowe, myself, and Sam Rogers, our Director of Enforcement, are available for questions.
Your first question comes from Stephanie Marotta at the Globe and Mail. Go ahead, Stephanie. Just unmuting you.
Hi, thank you for taking my question. My question is for both the Mayor and Dr. Lowe. So workplaces make up a significant portion of outbreaks in both Peel and the province, especially in food processing and warehousing. But even though workers now have access to the federal paid sick leave program and more inspections are being done, workplace-related cases continue to rise, and businesses like retail and restaurants are under tight restrictions while some of the hardest industries remain open. So at this point, from a public health perspective, do you think there should be further business closures in hard-hit sectors to help curb spread among workers, similar to what we saw during the first wave?
So currently, Stephanie, I think the same businesses are closed as were in the first wave, but I'll let Dr. Lowe address that. I'm just looking back at the epidemiology study here. We have less than 3% as workplace outbreak over the cumulative numbers of cases. So certainly what we're seeing is still continues to be community spread and household spread. I know that we have worked well with the number of companies that have been experienced outbreaks. They have had the right protocols in place. They were able to safely quarantine, and we were able to contact trace, and of course they closed down and did the right thing, cleaned and waited 2 weeks and then before they reopened. So certainly, why don't I ask Dr. Lowe to also speak to whether or not he thinks some of those facilities, like I think you're speaking to the manufacturing and food processing, et cetera, where we have seen some outbreaks, whether or not that they should close. But at the end of the day, those are essential workers. And those are the essential items we all need and require for our daily lives. And I think the decision was made that because they are essential, that they stay open. Dr. Lowe, over to you.
Yes, thanks, Madam Mayor, and thanks, Stephanie, for the question. I think this is certainly, first of all, a provincial decision around further closures, just in respect of the use of their COVID-19 response framework. At this point in time, where we are, our picture in Peel remains quite turbulent, and so at this moment in time, I'm not recommending any additional restrictions. I do also understand, of course, that with many of these, industries, especially food processing, as you've described, there are questions around supply and food security issues if these were to close, and the nature in which they would close, as I understand it, is also challenging from an operational perspective from these places where it's getting them up and running again, depending on what happens, could present challenges. So again, this is something that I imagine is being discussed at the provincial level. From my perspective, where we're seeing the cases right now, our aim is to see over a full 2-week period what effect the grey lockdown measures have had. And in ensuring that we have the best results out of that, it really falls to the community to ensure that they're adhering with the rules and complying with the rules, and also to the point that I made around ensuring that we continue this important dialogue around how we protect essential workers where there is a bit more of a difficulty or challenge in ceasing that line of work. So I'm certain all these things are being weighed at discussions at the provincial level, but I have no further recommendations at this time on that sector. Thanks very much for the question.
Follow-up?
Yes, thank you both for that response. I have a follow-up on workplace inspections. So I'm wondering if you would be able to elaborate on the types of violations you're seeing and in which sectors. So what are some of the most prominent COVID violations and in which types of businesses?
I'm going to ask Dr. Lowe to come and respond to that, but actually, Sam, do you have any role in that as well? Is that something you can respond to? No, it's public health. Public health. Dr. Lowe will respond. Stephanie, thank you.
Yes, thanks again, Stephanie. Really appreciate the question. First of all, we work very closely with our Ministry of Labour and Training and Skills Development colleagues as responses to infractions and precautions in high-risk workplaces is typically within their mandate. But in the cases of outbreaks that we've investigated, a lot of the outbreaks really pertain to the use of various precautionary measures. So things like personal protective equipment, things like ensuring that there are engineering controls in places, seats marked off in lunchrooms. There's a whole slew of violations, and actually it's a really good opportunity for me to highlight that at our website, peelregion.ca/coronavirus, if you click on businesses, we actually have a whole toolkit for businesses around how they can have a workplace COVID-19 safety plan. It's absolutely essential and crucial that every workplace has one of those, keeps it updated and keeps it implemented at all times. And then certainly with our Section 22 that's in place, as well as existing regulations put forward under the Ministry of Labour's remit, any violations that come to light are being thoroughly investigated and pursued to the extent possible. And in terms of a sector specific that we're seeing it across all sorts of sectors. I've always known that the region of Peel has been home to many different industries. I've discovered just how many industries in terms of where we're seeing differences, different outbreaks and different breaches occurring. So this is not limited to one specific sector. It's something that every workplace in our region absolutely needs to get on board. If you still have workers on site, you need to be taking precautions and have a workplace safety plan. And one last thing for everyone who's all at work, also remember that a break from work is not a break from the precautions. Too often we've seen outbreaks and transmission where people say, I'm not on the floor, I'm not out on the line anymore, I'm in the back room with my friends, I'm going to take my PPE off, we're going to chat for 10 or 15 minutes, and next thing you know, there's COVID transmission that's occurred there as well. So let's take it seriously, let's make sure all those precautions are in place, and let's, we'll continue to do our part to investigate complaints and also proactively work with the Ministry of Labour to enforce the regulations. Thanks for the question.
Your next question comes from Isaac Callan at The Pointer.
Hi, Isaac. Welcome.
Hey, Mayor Crombie, how are you?
I'm very well.
Can I ask you a slightly philosophical question about the budget, if I may? So the city budget's been packaged up as a budget for difficult times, for tough times, a relatively low tax increase, as low as you can keep it without risking infrastructure, for the city's portion of the tax. And the regional budget is coming up, and at the region of Peel, you are responsible for, I think, 5 programs that come under the category of things like social assistance, with the inclusion of housing. And I just want to ask, in terms of a low tax increase at the region, is that something you support as well, or do you see that as benefiting property tax owners property owners, and then not being able to pay for some of those essential services that are needed to support some of the less well-off who've been particularly hard hit by COVID-19.
Yes, you're quite right. So at the city level, we're responsible for our infrastructure, transit, et cetera, roads, bridges, sewers. We are projecting a 1%, as you know, a 2.7% budget increase, a 1% impact to the taxpayer. And at the Region of Peel, of course, we haven't started those discussions yet, but we think they're coming in at approximately the same amount. Many of the programs that you're looking at, that you've identified, are provincially funded, and we're able to apply for grants and funding from the provincial government, either through some of the assistance plans or through the federal government, through Rapid Housing Initiative, RHI, et cetera. So there are programs and grants that are available for assistance.
Thanks. My follow-up's for Dr. Lowe.
Thank you.
Hi, Isaac. Go ahead with your question.
Hey, Dr. Lowe, thank you. I just want to ask a little bit about the grey zone and the red zone. I'm not asking, for a date when we move between the two. I don't think that's necessarily a responsible question, but we have those thresholds in the metrics that go up, but we don't necessarily have them in the same way going down. Have you had a talk to the province at all, and any idea about what sort of metrics you'd be looking at to re-enter the red zone from the top? Because currently the numbers only talk about entering the red zone from the bottom, if that makes sense.
Oh, absolutely, Isaac. I mean, we've noticed the same thing. And so we are continuing to have discussions with the provincial partners right now. But what I can share with you is that for us at Peel Public Health, thankfully, we have experience from the first wave with the indicators that were used previously. So those are the ones that we continue to use. As you recall, ensuring that viral spread and containment trends are coming down on a 2 to 4 week horizon, both stable or declining, as well as capacity in the acute care, in testing and in tracing, and really just making sure that if we're starting to move backwards within stages, that would be what we would use to inform some of my recommendations. Of course, we do continue to work with our provincial counterparts to understand, especially as eventually we will come up to the end of 28 days, what will the metrics be in determining a way forward. But certainly, at least we have the experience of the first wave to go with, and I think keeping a track of both capacity as well as spread is going to be vital to ensuring that we have a grasp on the virus in our community and are continuing to see progress in our efforts. Thanks for the question.
Your next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Welcome, Ashley. Hi.
Thank you. I was actually going to ask about your motion that passed last week, which just called on the province to see how it can potentially level the playing field between smaller and bigger retails, especially in the lead up to the holiday season. I know Premier Ford was asked about this today at his press conference, and it didn't really seem like they were planning to take any action beyond him saying that, he knows it's unfair and he knows it's unfortunate. Have you received any sort of response from the province based on your motion? Have you seen any kind of positive signs that something is potentially being done to attempt to maybe level the playing field, especially if this lockdown, persists beyond Christmas? Have you gotten any response from your motion?
Yeah, Ashley, it's a great question, and I thank you for it. And it was a difficult discussion at Peel Regional Council last week. Of course, you know that I thought that we should level the playing field, that it was fundamentally unfair that big box stores were selling both essential and non-essential items, whereas many of our small local businesses were closed, forced to shutter because of the lockdown, and unable to, sell their merchandise at the most profitable time of the year when they're making 40 to 50% of their annual revenue. So we just thought that the big boxes had an unfair advantage. So we also discussed that there were certain barriers to doing what I had asked, and certainly a disadvantaged people who didn't have credit cards or perhaps had accessibility issues. And so we tailored it to address the small business issue, which was, look, we need you to try and level the playing field in any way you can. We challenge you to do so, but do so safely at the right time. And I have had indications. In fact, I gave the same message to our Minister of Finance at the Big City Mayors call that morning, or the Friday morning rather, the Ontario Big City Mayors, when he came and spoke to us. I spoke to him about the same issue, and have heard back from him and back from the Premier that it is something being discussed. how we reopen businesses safely, but I think they're waiting to see that the numbers stabilize and start to decline. We are in lockdown for 28 days, so I think they're watching closely week to week if it's the appropriate time to start the reopening. We all saw the campaign that had begun today by the 50 largest retailers that were advocating for reopening safely at 25% capacity for themselves, but also for the small businesses, so just to level the playing field for everyone.
Follow-up?
Thank you. And my next question, and I don't know if maybe Dr. Lowe will want to weigh in on this as well, but I know that both you and Dr. Lowe have talked a lot about the need for sick pay and the need for the federal and provincial governments to step in to ensure that employees who do need to stay home for 2 weeks are paid to do so. I'm just wondering if you've heard anything about that, if you think the province and the federal government are actually moving forward on that. Is there any good news or any news, I guess, at all in regards to that request? Because it does seem like a pretty important factor in getting cases down if there's so much spread in workplaces, and especially in workplaces where workers have to be there. They can't close down, they are essential. So yeah, I was just wondering if you've heard any news from the province or federal government on that front.
Well, you've outlined the picture completely. So these are our essential workers, and they're also our precariously employed workers. Some of them are PSW, some of them work in manufacturing plants, some of them work in food processing, or some of them work in many places just to make ends meet. And as a result, should they test positive for COVID, they're not only fearful for their jobs, but they're fearful for their paycheck and fearful for not have the ability to provide for their families. So we want to ensure that there is some safety and some security there, and that they're not out transmitting the disease as transmitting the virus. So we want to be certain that they can take the time they need and isolate and quarantine, and that's why I know Mayor Brown is advocating for a second isolation center. Now that we have one here in Mississauga, we want them to isolate, and we want them to stay home if they can safely. If not, go to the isolation center, and we want them to know that there is a safety net for them, that they will be receiving their paychecks throughout that 2-week period. So the question was, has there been any feedback? And yes, there has been, as a matter of fact. I did have a call with Minister of Labour, Monty McNaughton, and he asked me how I thought that would work and how it could be safely delivered, and why I felt that, different vehicles that currently existed weren't meeting the need. And so we actually had a very productive discussion and a very thoughtful discussion, and I know he wants to do the right thing. So whether it's enhanced benefits that currently exist or some new vehicle to speak to this fundamental problem that we've been having, which has really been one of the sources of our spread, household spread, community spread, workplace spread, people who are going to work, who are infected, but maybe they're asymptomatic or maybe they have light symptoms, but don't feel that they can stay home and go without their paychecks, or else they wouldn't be able to provide for their families. So Dr. Lowe, I don't know if you want to add anything there. He's going to speak to it as well, but certainly it is a very important issue, the isolation center, and that sick pay be enhanced for those people who otherwise would continue to go to work and not safely isolate. Thank you for the question, Ashley.
Thank you, Madam Mayor, for the opportunity to respond, and thank you, Ashley, for the question. So sick pay helps us in 3 ways. Mayor Crombie has certainly outlined the important need for people who are sick and symptomatic to be able to be incentivized to do the right thing and stay home and self-isolate to prevent the spread. Sick pay also assists with people who may have symptoms and need to get testing, because we do know that one of the other challenges, especially with many of these workers, is they may have symptoms and they may actually decline to get tested altogether, because they're concerned that they'll need to, first of all, take time off to go get tested, and then second of all, if they get tested, they know they're going to be out for 2 weeks. So it encourages at least additional case finding through testing. And the third thing, I think, is it sends a really important message to employers, especially if there are additional employer protections that are built into regulations to make it robust. Because what we do know is that many of the people who are being impacted by this are people that are precariously employed. They are also new Canadians. They may be racialized Canadians for which English is not their first language, for which their understanding of their rights as a worker in our country may not necessarily be fully formed. And so what happens then is there is this fear that if I don't show up for this contract job that I've signed up for, I'm going to lose it, that sort of thing. So it allows us to continue to work with them, and we are working to get culturally appropriate messaging out with community leaders to say this is not the case, these are your rights as a worker, within the Canadian labour force. But it also sends a clear message to employers that we're taking this seriously, that they need to take care of their workers who are sick, who have COVID-19, and to make sure that they get tested, and that if they get tested and they test positive, that they're staying home and they're helping to stop the spread. Thanks so much for the question, Ashley.
Your next question comes from Steve Cornwell at Mississauga News. Go ahead, Steve.
Welcome, Steve.
Thank you, Mayor Crombie. Thanks for the update today.
Thank you for joining us.
My pleasure. Question around kind of supports from other local officials. There's been some comments in the past few kind of council meetings, I'd say specifically around the Peel Regional Council meeting last week and the non-essential versus essential kind of big box and small retailer, that debate that happened there. How would you rate kind of the performance of local MPPs in Mississauga in terms of advocating for the interests of both Mississauga residents and Mississauga businesses? And I ask that because there were some kind of cutting remarks that were made from Mississauga councillors about their local MPPs.
Well, we all have a job to do, and we work as collaboratively as we can. And I think we have an excellent relationship with our MPPs. And quite frankly, this motion was directed to the Premier, and they were CC'd, and they were asked to continue to advocate on this issue. But I know that I have a very excellent relationship with the Premier himself and with the Minister of Finance, and I've taken it to them directly. And I know that our MPPs have the best interests of Mississauga in their hearts, and they will also advocate for our small businesses.
Follow-up?
Thank you. My next follow-up question would be for Dr. Lowe, if possible.
Absolutely possible, Steve. Go ahead with your question.
Thanks, Dr. Lowe. Question around, Mayor Crombie mentioned some preliminary planning around vaccine distribution, and I know it's early days and we're putting the cart before the horse, so to speak here, but what can you say about how the vaccine might be distributed in Peel? Like what are some of the priorities that you might have around that, and what may a resident that's seeking to get vaccinated for COVID-19 in the early days do? What might their experience be like to get the vaccine?
Absolutely, Steve. So the first thing I can say is at this time, our priority is really information sharing. So we are pulling together with our local hospitals, Ontario Health, local healthcare providers, community agencies. We're really trying to put together a team that's trying to understand the information that we're getting from provincial and federal governments around an approach to immunizing the community and those priorities that have been identified. And we will take our cues, obviously, from those levels of government in trying to understand how it will proceed here in our community. We also know in planning, we've been advised to understand that the first batch of vaccine demand will likely outstrip supply, not surprisingly, but as we understand it through 2021, with the contracts that are in place, as we understand, that we can expect more and more supply to come along, and different players will play different roles in vaccinating as we go forward. In respect of priorities, I think I would turn, as many other public health physicians would, to the National Advisory of Community Immunization advice. They've published a detailed article in the Canadian Medical Association Journal that specifies high-risk populations first, so elderly and those with medical conditions, and then people that work with those populations, healthcare workers, etc., and then other high-risk occupations such as police and fire, and then from there other identified priority populations within a community context based on epidemiology and the community situation. So that's kind of just general principles that the National Advisory Committee has put out. However, they don't speak to exactly what the Ministry of Health will direct us to do. And as I've said, we will take our lead from them together with the group that the task force, the group that we're forming to really understand where we'll be going and how we'll be working with the ministry partners to get this out to people in Peel. Thanks very much for the question.
Last question comes from Khalid Sawan at My Second Home TV. Go ahead.
Crombie, how are you?
I'm very well, thank you.
Thank you. I want to touch again on your motion. What did you ask for and was not agreed on? So it was anonymously also passed.
What I had asked for was a leveling of the playing field so that if the small retailers had to shutter, which they have because of the lockdown, that only the big box stores that are permitted to remain open, that they be permitted to sell only essential items, not the non-essential items. So not the hunting goods and not the electronics and not the home decor items that our small retailers are unable to sell right now because they have to close. So it set up a very unfair competitive advantage for them. And as we can see, the big box stores have massive lineups. People are fighting to get inside. They're not doing crowd control, adequately. And, they are selling items that other stores, other retailers are not permitted to sell. So if we were asking people to stay home and only go out for the essentials, then it's only the essentials that should be purchased. In my view, I was in a minority in regional council, and we we altered the motion to state that we are asking the Premier to level the playing field. We challenge him to find a way to open all businesses safely at the appropriate time.
Follow-up?
Yeah. My follow-up for Dr. Lowe, please.
Yeah, before Dr. Lowe comes up, if I may also add a little, enhance that a little bit, and I'd like Sam to come up too, because what I want to suggest to you, Khaled, is that we had a high degree of compliance among our stores over the Black Friday weekend and the cyber sales on Monday. I was very proud of our businesses. They're following the rules. There's a high degree of compliance. Sam has quadrupled the coverage of bylaw officers in the evenings, and on weekends they're making proactive inspections, and I'm so very proud of them. And did we have a couple of car dealerships and an appliance store and electronics store stay open? Yes, we did. But for the most part, we had a very, very high compliance rate. And disappointingly, as you recall, I spoke about the house party that should not have occurred and was shut down by both police and bylaw. And Sam, could I just ask Khaled, if you don't mind, Sam to talk a little bit about bylaw enforcement for you as well? Sam?
That would be great. Thank you.
Well, thank you very much, Mayor Crombie, for the opportunity to just expand a little bit on our current program. So we've got at our core a team of 40 officers who are out proactively inspecting businesses, as I said earlier in my statement. What's really encouraging is that our compliance rate on a re-inspection is 99%. So of the 5,000 businesses, for example, that we would have inspected, the first time there may be a high rate of non-compliance. The main reason, people don't understand the rules. It's not because they're intentionally violating. And so what we found is, even though on our first inspection there's a low compliance rate, when we come back the next day, they are compliant. And that's what that 99% is. That's a key measure for us and a great indicator, as Mayor Crombie said, of people's willingness to abide by the rules once they understand them.
So it's about education first, right?
Absolutely. The challenge we have is we are in a lockdown, and we understand the intent behind these lockdown rules. That's to limit interactions and limit the spread. So when we do see businesses that are aware of the rules and continue to violate them, we progress quickly through enforcement and move into charges very quickly now.
I'm a little bit curious, what kind of infractions did you notice at car dealers?
Well, I won't speak specifically about any sector. I can tell you they range from face coverings, not managing gatherings, to knowing that they are not essential, should not be open, and are communicating to customers to sneak around the back and come in through the back. We've seen all types of workaround attempts, blacking out windows, communicating to customers to park in other parking lots and come around the back. But we are aware of what's going on, and our record this past 10 days shows it was over 60 charges and 50 notices of contravention.
Thank you so much. My follow-up for Dr. Lowe, please.
Hi, Khaled.
Hi, Dr. Lu. Last week I didn't get to ask you the question because they thought I did already. It was a little bit funny, but anyhow, I'm not asking two questions today. Only one question. Premier Ford mentioned about the rapid test at the airports, and it may result in reducing the quarantine period into 7 days or none. Can you please elaborate on that, and what kind of rapid testing would be at the airports in case it will be approved and when?
Thanks, Khalid. Certainly, the airport has convened a joint industry government task force that is looking at the use of rapid testing to reduce quarantine times. I think it's certainly a worthy idea to be studied. And my understanding is that this would be a pilot that would be undertaken, but further details are being worked out. The theory would be, as seen elsewhere, whether it would be a case of you take a test on arrival, and then at some point during your quarantine, and then you would be released from quarantine if it turns out negative, usually say 5 to 7 days after returning. I think the important things that I would note are, first of all, some element of quarantine would still be warranted. Second of all, you'd need to be absolutely sure that people are not testing positive, or that you're not missing individuals who might test positive beyond the outer range of whatever date you pick. And then thirdly, that in terms of real-world applications, it may not necessarily come to pass just very soon, because we do know that there is still a federal advisory against non-essential travel outside of Canada at this point in time, and we do know that the COVID-19 situation in other countries certainly can be vastly different to what we're experiencing in Canada. So if it's for that reason that travel outside of Canada is strongly discouraged. Thanks very much for the question.
You're welcome. Thank you.
That wraps up our press conference for today. On behalf of Mayor Crombie, I thank everyone for tuning in, and see you next week.
Thank you very much.